Now I figured out why they bring their laptops up. It's so that they can actually see the presentations. So I'm going to, although I did my PhD in the lab that discovered neutrophil elastase, I'm not going to talk anything about neutrophil elastase and elastin degradation. I'm going to talk about the AlphaNet model, which you may or may not have heard about yet, and kind of introduce you to, if you're not familiar with it, AlphaNet Canada. I'm going to be focusing a lot on history because I'm old, and so I tend to look back a lot. And I hope that it's something that you will learn about in a way that will make you want to participate in AlphaNet Canada and also the other services that are available to Canadian Alphas. There's a lot of organizations that have been around in the Alpha 1 community over the decades. Some of them that you may or may not have heard of that don't exist anymore, things like the Alpha 1 Advocacy Alliance, the Foundation for Alpha 1 Lung and Liver Disease, have gone by the wayside. One of the first organizations in the United States was the Alpha 1 National Association, which became the Alpha 1 Association, which was eventually incorporated into the Alpha 1 Foundation in the US. And now we're left pretty much with these four organizations. Oh, I need to advance it, don't I? Not sure where the advancer is. I found it, don't worry. So that's what I was talking about, was all of these organizations. And those that have left us and gone in a different direction. And now we're left with the four organizations in the US and Canada that I'll kind of be referring to during this presentation. The bylaws of AlphaNet in the US and Canada say that the purpose of AlphaNet as an organization is the provision of health management services to persons affected by Alpha 1, which includes contributing towards the advancement of medical research, public and patient education, patient advocacy, and medication and disease management services. It's a long way of saying that what AlphaNet does is help patients live better through education. And once again, to understand our program, you have to understand our history. In the US, the Alpha 1 Foundation and AlphaNet are two 501c3 not-for-profit organizations. In the US, AlphaNet, in Canada, AlphaNet Canada is a Canadian charitable organization. Both of these founding organizations were started by 3 Alpha 1 patients to improve research and care in Alpha 1 antitrypsin deficiency. In the US, AlphaNet initially started in that 1995 time period with the goal of being a not-for-profit home IV company. They saw that the home IV companies that were administering prolastin, the only available augmentation therapy in the US at the time, this augmentation therapy that's been described by the two excellent preceding speeches, that those home IV companies were making a ton of money from giving that augmentation therapy. And these patients thought if they started a not-for-profit home IV company, they might be able to take some of that money that was made and turn that into money that could be spent on research to find a cure for Alpha 1 antitrypsin deficiency. So that was, in many ways, the start of both organizations. In 1999, when there was a shortage of augmentation therapy in the United States, AlphaNet changed to being a health maintenance organization. We decided that patient self-management was the way to go to help patients manage their own care. And by 2000, we were following 99.8% of the patients in the US that were receiving augmentation therapy. Currently, the AlphaNet program in the US follows over 6,500 patients receiving augmentation therapy, And we also have a relatively new program called the REACH program, risk evaluation to assure continued health is where the REACH acronym comes from. And we follow patients who have alpha-1 antitrypsin deficiency and are not on augmentation therapy to help them maintain their health and know when to start augmentation therapy appropriately. Most important point, all these services are free to patients. They're not free, the services, but they're free to patients. They're free to patients because the funding comes from the industry partners that make augmentation therapy. John Walsh, one of the 3 patients who started AlphaNet, says it's the ultimate recycling of the healthcare dollar. And the motto of AlphaNet here and in Canada is alphas serving alphas. 90% of the employees at AlphaNet in the US are alpha-1 patients who are working full-time with full benefits from AlphaNet. And similarly, AlphaNet Canada hires alpha-1 patients as the disease management coordinators that serve alpha-1 patients. The little dog in the bottom is Alf from the Big Fat Reference Guide, which I'll talk about in a second. Going on with AlphaNet in the US. In the US, the board of directors, by bylaws, is a majority alpha-1 patients or people affected by alpha-1. It provides patient self-management instruction, clinical trial support. It also supplies IT services, information technology services, human resources, and accounting services to other organizations in the local community as a way of raising funds for research in alpha-1. The hallmark of alpha-1, and I'll talk about it in a little more detail, is the Big Fat Reference Guide, or the BFRG, and the accompanying skinny little reference guides, which you can find outside in both French and English, outside the door, that cover specific individual topics. We have nurses, we have a medical director, we have a biostatistician on staff. We're a licensed Florida wholesale pharmacy. We employ 65 alphas nationwide in the United States, and it's all run by a proprietary, confidentiality compliant, web-based contact management and research software application that we built ourselves. So we like to say that AlphaNet was founded by alphas, governed by alphas, an employer of alphas, provides services to alphas, and in doing that, we generate funding for research that is hopefully going to lead to a cure for alpha-1. In fact, since its founding, the AlphaNet in the US has donated over $55 million to the Alpha-1 Foundation to support the foundation's research mission. So the heart of AlphaNet are our AlphaNet coordinators, all of whom are Alpha-1 patients. But the brains of AlphaNet is the disease management program, which we call ADMAP, which stands for AlphaNet's Disease Management and Prevention Program. The history of this program I find interesting because when I first became involved with it, really was skeptical of the concept of a disease management program. I thought it was kind of a fad, that it really didn't do anything. But we thought we would aim a disease management program at physicians, because we learned when we looked at our AlphaNet population that we were following, that the majority of patients that AlphaNet was following in 2000 were followed by physicians who had only 1 or 2 Alpha-1 patients in their practice. And we thought, wouldn't they like to have something that would help them manage those rare Alpha-1 patients in their practices better? So we aimed the program at physicians. We prepared a program designed to help a physician with sections that were like what to do on an initial visit with an Alpha-1 patient, what to do in follow-up visits, how do you care for the lung and liver disease of Alpha-1, what do you do when someone presents to you with an exacerbation. All of these things that we thought a physician would want to know. We did a pilot program in South Florida. In South Florida, we offered pulmonary physicians and primary care physicians who we knew had an alpha-1 patient, because we were following them at AlphaNet, this disease management program to help them manage their alpha-1 patients. They gladly accepted the manual we had prepared. Most of them stuck it in their bookcase in a very prominent position. But when we came back a year later, we found all of those manuals covered with dust, and that none of them had ever taken that manual down from the shelf and actually used it when they saw an alpha-1 patient. It actually led to issues that we were trying to correct. When we asked those patients, did you use this to make sure that you tested liver function in your alpha-1 patients that were coming to see you for lung disease, they would usually say, there's liver disease in alpha-1? And so the only time that this actually was well used was in a practice that had a very active nurse practitioner or nurse assistant in the practice who would often welcome something like that. But the general physician practice didn't do it. So what did we decide to do? We decided to restart and revamp the program and aim it in 2002 at patients and their families. We appreciated that, in fact, most of what physicians learned about alpha-1, they learned either because they'd identified an alpha-1 patient, and so they went back to their textbooks or the literature to remind themselves what alpha-1 was, or they learned about it because their patient came in with stuff they found on the internet or educational pieces they'd gotten from the Alpha-1 Foundation and said, here's how you're supposed to manage me. So we developed the BFRG, the Big Fat Reference Guide to Alpha-1, which was done in a kind of a humorous format. It had areas that every page had a table that summarized what was on that page. People could go into more detail if they wanted to, and there were even references at the back of each chapter if people wanted to see them. It had 35 authors. It was overseen by a disease management advisory committee, and it was about 750-page loose-leaf notebook. We did it that way because we thought that over the years, obviously, technology would change, and we could insert new chapters that were updated and things like that. And it was initially, literally, a big fat reference guide. It was a huge document. As you'll hear, we did an outcome study where we provided every patient in this, 1,000 patients in this outcome study, 2 copies of the Big Fat Reference Guide, one for themselves and one for the doctor that managed them most closely. And the one for the doctor actually had continuing medical education credits that they could get by reading the Big Fat Reference Guide, taking a test, and sending it into the American Thoracic Society, and they'd get a bunch of credits towards their ongoing education. We also, with time, developed these 13 skinny little reference guides that were the areas of the book that people most often went to look for information. Things like traveling with oxygen, things like what's augmentation therapy. And so that became the most up-to-date sections. We learned that, in fact, this goal of sticking in revised chapters and stuff turned out to be really difficult, because if someone missed a revision and tried to put a second revision on top of a notebook that hadn't had the first revision, things would get all confusing. And so we realized that that was a great idea, but maybe not one that we could actually work with. So what happens when someone enrolls in AlphaNet? Well, and this is the case for AlphaNet in the US and AlphaNet Canada. They are immediately assigned to a personal AlphaNet coordinator who's their coordinator on into the future. They are regionally based, both in Canada and in the United States, so it's usually someone in your state or province or part of the country. They provide education about the AlphaNet program. They're available 24 hours a day, 7 days a week for questions that might be available. They're not available to tell you what medication you should start on if you have pneumonia, but they are available to help you with any questions you might have about Alpha-1 in general and things along those lines. There's a medical team at both organizations that's available for consultation either by the coordinator or directly to the patients or their physicians. There are patient satisfaction surveys we send out to learn where we could do better and do more. And there's patient and caregiver support. And there is healthcare utilization, quality of life, and illness severity questionnaires that are administered on a monthly basis to get an idea of how someone's doing over time and how the whole population of Alpha-1 patients in a given region are doing over time. So let's talk a little bit more about the AlphaNet coordinators and how things are organized. The AlphaNet coordinators, in the case of Canada, we have 3 of them. In the case of the US, we have 65 of them. Each coordinator follows about 100 to 150 patients that they call by telephone every month to answer any questions and to find out how patients are doing. In the US, those AlphaNet coordinators look something like this. In Canada, you have 1/3 of the coordinators here today with you right now. The disease management program, though, isn't just a big book, the big fat reference guide, because the big book is now on the web, on thumb drives, on telephone apps that are searchable and a little more convenient than walking around with a 5-pound notebook. There's coordinator training and testing, patient and professional education. Here you go. Patient worksheets, AlphaNet coordinator follow-up, outcome measurement, and all overseen by a blue ribbon disease management advisory committee. When we first did this, we said, well, this is a lot of work to do and a lot of money to spend on salary and big fat reference guides and things like that if we can't actually demonstrate that it helps patients. Wasn't enough, in my mind, that we labeled something disease management and thrust it out there into the community unless we could document that it had some benefits. And so the first 2 years that we were preparing the disease management program and then rolling it out, we did a study comparing the year before disease management services were rolled out and the year after disease management program was rolled out to see if it actually provided some benefit to the community. In all honesty, we didn't expect to see a huge change in 1 year. We think of disease management and disease self-management as an ongoing process that should essentially snowball as you learn more and do more to keep yourself healthy. But surprisingly, in that 1 year, we demonstrated some pretty remarkable benefits from this self-management program. For instance, the first year compared to that control year before we rolled out disease management, we showed that there was an improvement in compliance to weekly infusions. People understood why infusions were important, and so we actually showed that fewer times during the year, patients said, oh, you know, I'm busy this week, don't infuse me, or I'm traveling, I don't want to worry about it. They maintained their weekly infusion schedule. There were fewer, shorter, and less severe exacerbations in the year after the disease management was put in place. There were fewer hospitalizations, fewer ER visits, and fewer unscheduled physician visits. There was less antibiotic and steroid usage. There was better use of oxygen, using oxygen appropriately at the right doses at the right time. And surprisingly, there was evidence of survival improvement. And I'll talk a little more about that in a second. This is what the numbers looked like. They may look like the improvements are small. In other words, the hospital admissions, if you look down the right-hand column, went down by 11% from the first year to the second year. The ER visits went down by 22% comparing the first year to the second. MD visits that were unscheduled went down by 9%, and days on antibiotic went down by 11%. Small differences that actually over time make a big difference, both in terms of how much you're exposed to significant healthcare interactions, but also how much you're exposed, for instance, to antibiotics and steroids. Now, we have, over the years, looked at survival in our large AlphaNet population, since we have such a large number of patients, and since, unfortunately, people do go on to die or require a lung transplant. And what we found, if we compare ourselves to a study that's often cited in the literature, in 1994, a study from Denmark, where individuals were shown to have a 49.4 year median survival if they had lung disease and were not on augmentation therapy. So what does median survival mean? When you say 49.4 years, it means that at that age, 50% of people with lung disease due to alpha-1 are alive and 50% are dead. Doesn't mean that when you reach 49.4 years of age, you're going to fall over. But it's a measure of what the survival is in a given condition. What we found in 2003, 2 years after we rolled out the disease management program, and in a group of patients who are all on augmentation therapy due to lung disease, that the median survival in that group was 60.3 years of age. Now, we think that's an improvement in survival. We think that most likely that improvement in survival is due to not necessarily the disease management program, but more likely the use of augmentation therapy, since all the patients in 1994 had lung disease and were not on augmentation therapy, and all the patients in the survival study in 2003, which was done on over 2,000 patients compared to the 1994 study, which just looked at less than 100 patients. Most of that improvement is probably due to better treatment of COPD and augmentation therapy use. We've recently completed a survival analysis on alpha-1 patients with lung disease on augmentation therapy in AlphaNet who've been on the disease management program, the ADMAP program, all through that time from 2003 to 2016. And what we found was that the median survival is now 80.4 years of age, which is starting to approach the median survival of the general population. So we feel that's very encouraging. Once again, some of that improvement could be better use and newer inhaled medications, treatment for COPD. And some of it, we believe, some of that increment, we believe, is due to the disease management program. And I emphasize, it's a disease self-management program that you do yourselves. So what about AlphaNet Canada? To talk about its long history. It was founded in 2014, January of 2014. It has a board of directors that is Canadian alphas and scientists. It has the same mission as AlphaNet US. It enrolled its very first patient with alpha-1 antitrypsin deficiency in 2014. Let me get over to that slide. In 2014, in May of that year, it has an AlphaNet coordinator manager, Mike Ben, who's here with us today. I encourage you to attack him with any questions. And we have our Western coordinator, Ernie Ingalls, here today. We have two Eastern coordinators, John Holmes and Hélène Matton, who I'm pronouncing with my terrible French accent because she handles the French-speaking alphas in Eastern Canada. It just passed 350 AlphaNet Canada participants. And if you're interested in joining AlphaNet, all you've got to do is see Mike Ben or Ernie Ingalls, and they can tell you how to do it today. So what happens when a patient joins AlphaNet? An AlphaNet Canada coordinator will call you every month. They'll answer any questions you have. They'll help you understand alpha-1 antitrypsin deficiency and its treatment. They'll ask you about your health utilization over the past month and potentially talk to you about studies you might qualify to participate in. And they make sure that you are a member of the, I now know that it's the Alpha-1 Canadian Registry, not the Canadian Alpha-1 Registry, and that you participate with Alpha-1 Canada as an organization. Your coordinator will be available to discuss issues that occur outside of your monthly calls with a simple telephone call. So, can my AlphaNet Canada coordinator help me receive augmentation therapy? Well, that depends. It obviously depends on where you live and what your insurance is, what your health care coverage is. They can tell you what your province or territory has available, and if necessary, ways that you can advocate to receive therapy if that's what you and your physician feel you need. They will emphasize the many things that you can do to keep yourself healthy, in addition to the use of augmentation therapy. Because we know from our disease management program results that it's more than augmentation therapy that keeps alpha-1 patients with lung disease and liver disease healthy. So what can you do? You can join AlphaNet Canada. You can participate with Alpha-1 Canada. You can join the Alpha-1 Canadian Registry. You can go to your local support group or start one if there is none near you. You can advocate for Alpha-1 support and therapy, and you can live a long and healthy life. If you take care of yourself, do the things that keep you healthy, take your medications as your doctor prescribes, exercise, eat well, and be the best alpha you can be. So you can put the fact that you're an alpha in the back of your mind instead of in the front. So in summary, the ADMAP program, Alpha-1 Disease Management Prevention Program, has been shown to be effective at improving the health status of individuals with Alpha-1. The concept of training patients to act as self-management coordinators has been one of the keys to our success. And another factor is that every aspect of our program has direct patient input and supervision. And so I hope you've learned a little about AlphaNet Canada and the services we hope to provide, and that if it fits with what you think will help you, that will consider joining and moving forward. Thanks very much.